Dr. Rose is going to use the frame method. This entails F for familiarizing yourself with the patient, R for reduce, A for assist with the message, M for mixed communication modalities, and E for engaging the patient. First, she will familiarize herself with the patient and how the patient communicates and expresses herself. She will also utilize compassion by relating to the patient's interests.
Come on in, guys. Have a seat. Hi, what's your name?
Hi, I'm Mandy.
I'm Dr. Rose. Good to meet you.
Nice to meet you.
How are you doing today?
So we have Lily here today. Do you want to talk to Dr. Rose? No?
That's a really awesome shirt that you have on. Do you like Disney?
Yeah.
Really? What's your favorite movie?
Little Mermaid.
I like that one too. Hey, what if we put some Little Mermaid music on? Do you think that would be a lot of fun?
Yeah, I think that sounds like a good idea.
All right, I'll do that for us.
Thank you.
Now Dr. Rose is going to practice the reduce part of the frame method. Notice how Dr. Rose reduces the words that she uses. She will only ask one question at a time, and then she will wait for Lily to respond, even if Lily's responses are slow.
Do you brush your teeth, Lily?
Yes.
How often do you brush your teeth? Do you brush your teeth 2 times a day? Do you brush your teeth 20 times a day?
Yeah.
The fact that Lily nodded to this question is indicative that Lily's responses are likely not representative of reality. This is why Dr. Rose turned to the caregiver to ask about the oral health history and practices. It is important to gauge how much a patient is capable of answering questions for themselves by thinking about the answers they give and determining if they make sense. Asking really ridiculous questions like this can help the provider to see if the patient is aware of the absurdity of the question. However, the provider must be careful that the patient isn't answering jokingly or with sarcasm. If they are, then that would be indicating that they have an understanding of the absurdity of the question and are answering it according to their own sense of humor.
Come on, Lily. So she brushes twice a day, once in the morning and once at night.
Okay.
Now Dr. Rose is going to use the assists with a message part of the frame method. Notice how she asks Lily more questions to help with getting the message across. Dr. Rose will also use the mixed communication modalities part of frame, in which she uses different ways to communicate the same idea so that Lily can understand.
Do you floss, Lily? Do you ever use this? Okay. Let me show you how it works. It's a string, and this is a model. So you put the string in between the teeth. Do you want to hold the model for me? Just like this.
Oh, Lily, honey, don't do that.
In between the teeth, just like that.
Yeah, it's very difficult for us to floss, so we typically just skip it.
Okay, well, let's have Lily practice here. Why don't you put the floss between the teeth?
Just do it like how she showed you.
That's a good start. We can work on that.
Lastly, Dr. Rose will practice the engaging the patient part of the frame method, in which she is always asking the patient first and making Lily the priority. This way, Lily feels important and respected in the dental chair. If there is confusion, then she will ask the caretaker. While the provider may get more information out of the caretaker than the patient, it is important to not neglect the patient in questioning their own health. This can make the patient feel more important and necessary in the conversation. Verifying the information or retrieving additional information from the caretaker is critical. However, including the patient in these conversations is also important.
Lily, do you take any medications?
Yes.
What kind of medications is she on?
Oh, I have her list right over here.
Thank you.
Now that Dr. Rose has developed a relationship with both the patient and the caretaker, she will start the procedure. She has gained more trust from Lily than she had before when Lily first walked in.
Open big for me. Does that hurt for you, Lily?
Mm-mm.
Okay.
Dr. Rose is checking for a placebo effect to get a measure for Lily's anticipation and anxiety. When Lily indicates that it doesn't hurt, Dr. Rose will feel that it is safe to continue.
Okay, open big for me, Lily. Does that feel okay to you?
Mm-hmm.
Dr. Rose is asking the patient more questions to make sure that Lily is feeling listened to and understood. It gives Lily a sense of control, knowing that what she is feeling matters to Dr. Rose.
Okay, Lily, can you open your mouth for me? Thank you. Okay. Do you feel this on your tooth?
Mm-mm.
Okay. I'm gonna try again. Open big.
Yeah, that hurt.
You felt that? Okay.
Listen to how Dr. Rose first asks about the feelings of a tooth that she knows is okay to Lily. Then she asks about another tooth. Now that Lily has expressed that a couple teeth feel okay, Dr. Rose can be assured that the tooth that hurts actually does hurt Lily and should be examined more thoroughly for possible decay.
Thanks so much for coming in today, Lily. I had so much fun with you. I can't wait until I get to see you again, and then we'll work on some of those fillings, okay?
Okay.
All right.
Communication with patients with special needs is one of the most important parts of treatment. Communication involves making them feel like you are their friend and you are there to help them. It limits the anxiety so that you can do the procedure that the patient needs. Asking questions and analyzing their responses is key to understanding the communication. Don't forget to use the frame method. With effective communication, we can make a positive influence in the lives of our patients with special needs.